Good afternoon, everyone. So we're gonna get started in view of everyone's time, and thank you to everyone who's joined us. And we'll be going through some quick introductions at the beginning of the session, and hoping that you can stay until the end for some time, for some open time for discussion and questions and answers. So we're really excited that you're all here with us today, and we're going to get things started. And today we're going to be going through this webinar. We have 90 minutes scheduled for it. It might take a little bit less, depending on the questions and the participation that we get from everyone. And if you have technical issues, please send a chat to myself, Maria Bustamante. The session is being recorded, and you will be able to get an electronic copy within a week of today's webinar. And you will also receive the evaluation at the end of the webinar, and we hope that you participate in it so that we can improve with your feedback. And at any time during the webinar, you can ask us questions. You can do that through the chat option. So we have that chat option available for you, and we also have a Q&A if you want to send us a more private question. We would gladly answer all those questions at the end of the presentation. And you can also raise your hand. You're all unmuted. You're all muted as you come in, and we will open that up at the end. And my name is Maria Bustamante. Again, thank you for being with us today. I'm the Health Initiatives Program Manager for the National Center for Farmworker Health. And the National Center for Farmworker Health is a private not-for-profit organization. We are located outside of outside of Austin in Buda, Texas, and our mission is to improve the health of agricultural workers and their families. And with that said, we do that through different training opportunities, educational opportunities, just like this one. We do training and technical assistance for the different health centers throughout the country. And we are celebrating our 50th anniversary. So this year, so it's really exciting. And we're also celebrating today because we're in November, right? We're celebrating Diabetes Awareness Month. And as we think about it, just feel free to add in the chat from where are you joining us, and what is one word that comes to mind when thinking about diabetes? Is it what's the first thing that comes to mind? And at the same time, this year it's going to be in 10 days. It's going to be World Diabetes Day, and the theme is wellness. So we also have to think of ourselves, and also think of any person living with diabetes, and how they can manage their diabetes as well as good as they can, and how we can help them improve on that. So thank you for your comments, and in the chat I see them come in. And yes, a happy anniversary to NCFH. We're really excited, and we're really glad of the work that the organization does for everyone. And yes, self-care. Self-care is very important, and it's part of the wellness as well, right? Um, I also saw a comment come in of management. And yes, having been making diabetes manageable, right? It is manageable. if we support our patients and control. Yes. Perfect. Thank you so much. And let's move on. Mm, I moved on too much. Let's move on to a couple of the things what we're going to be going over today. So we're going to be understanding the effects of diabetes in our body, learning a little bit about self-management and ways that to prevent complications. Specifically, we're going to be having great guest speakers to share with us some really good information about eye health, about heart disease, and any cardiovascular diseases that may be complications from diabetes, as well as from kidney health. So you're not only going to be listening from me, you're going to have some really good speakers coming up. So, with that said, let's just kick it into, you know, just the staggering number of the statistics about diabetes, right? We hear this number continuously and it never ceases to amaze, like the amount of people that have diabetes in the US. It's 38 million. It's 1 in 10, and some estimates even take it 1 in 11 Americans. So that number is only the iceberg, the tip of the iceberg. If we also think about the number of people who also have pre-diabetes or are at risk of developing type 2 diabetes. So just to put everything into perspective, and our work as health educators uh, is continuing, and there's a really big need for it. But what can we do? What steps can we take as health educators to help our patients, right? That's one of our main goals always. And we can start by teaching the warning signs and symptoms of diabetes. Very basic steps. Teaching them what they have to be aware of, uh, and what signs they have to be like on top of, and if they have any symptoms to react fast. At the same time, we have to promote those checkups and test to detect diabetes early. And with that, we're also talking about that access to care, right? We need to increase access to care for patients and for people in our communities, especially if they have a risk of becoming of getting diabetes. We also need to be diagnosing diabetes on time. And with this that early diagnosis, we are not only avoiding complications of diabetes itself, we're also avoiding so many other health issues, right? And that's what part of what we're going to be going over today is all those different issues that can come from the early diagnosis and avoiding complications. And we have to educate our patients to prevent an uncontrolled diabetes. Right? We have to teach them how to live with diabetes and be able to control and manage, which were those two words that we got from participants at the beginning, right? And learn how they can live with it. As we go into diabetes, and we talk a little bit about what diabetes is, and the most simple and common description that we always hear is diabetes is high blood sugar, right? And that's the most basic and simple description. And as we think about it, and we realize that our body has blood everywhere, right? We have but our human body has blood in every part of our body, so it makes it a whole body disease. Uh, whenever our blood has high levels of sugar, that high level of sugar makes the blood dense and makes it more difficult for all of our body and our circulatory system to move the blood throughout the different parts. And from that, we start getting the different complications. That stress of heavy, dense blood, which is a blood that has a high level of sugar, starts to create those damages to our organs or to our circulatory system, and we start getting eye complications, right? What is the most common eye complication from diabetes? And we're going to go into that, and we're going to have someone explain those very most common complications to us in a little bit. And they can lead to retinopathy and blindness, right? The same thing with heart health. From the heart if pumping blood that is dense, it creates all that extra stress level in it, and all the different complications that we can get. And the same with kidney health. Eh, that is kidney health, diabetes, and heart health. It's usually referred as a trifecta factor. One starts and the other two continue. And we have to stop that effect, right? We have to have a consciousness that this can happen, that this is a very common complication and progression of the disease. And when it's being managed and controlled, it doesn't have to happen. And that's why we're here, to learn more a little bit of all these three different health effects of diabetes in our body. And with that, I'm going to kick it off to our first presenter of today. Today we have Prevent Blindness, and we have Nita Sinha with us, and she's going to be sharing a little bit more of what uh, eye health uh, is and how it can be affected with diabetes. So welcome, Nita.
Thanks, Maria, and thanks for having me today. My name is Nita Sinha. I am the Senior Director of Public Health at Prevent Blindness. Prevent Blindness is a 100-year organization with our mission is to prevent blindness and preserve sight, and we do that by educating, advocating, and collaborating. Next slide, please. So previous slide, please, Maria. Thank you. I was invited today to talk about diabetes and how it affects the eyes. Diabetes can cause diabetic retinopathy, and diabetic retinopathy can cause trouble reading, seeing faces across the room, seeing at night, and even cause blindness. Diabetic retinopathy is the leading cause of blindness in working age adults in the US. It affects the retina, which is located in the back of the eye. The retina captures images, and it takes it to the brain via the optic nerve, helping individuals to see. When somebody has diabetic retinopathy, it affects the small blood vessels in the back of the eye in the retina, and it causes them to bleed and leak, affecting and impairing vision over time. As you can see in this image on the slide, you can see areas of darkness, and that's what diabetic retinopathy can cause to an individual's vision. Next slide, please. It's important to note that there are symptoms of diabetic retinopathy, but the early stages of the disease have no symptoms at all. So the most important thing is to see an eye care provider, an ophthalmologist or an optometrist every year and get an eye exam so that diabetic retinopathy can be found early before symptoms even start. If an individual has type 1 diabetes, it's recommended to have a yearly eye exam starting 3 to 5 years after diagnosis. And if an individual has type 2 diabetes, it's recommended that the individual start to have an eye exam immediately upon diagnosis or soon afterwards, and then yearly afterwards. And, it might be more often for both types if the eye doctor recommends it as well. And if your patient does tend to have symptoms, some of the symptoms related to diabetic retinopathy are sudden increases in eye floaters, which can be spots or dark cobwebs in your vision, blurred vision, sudden missing or dark areas in vision, flashes in light, difficulty seeing at night, and not seeing vibrant colors, having them appear faded. But just to note and reiterate, getting an eye exam is the most important thing that can be done before these symptoms can start. Next slide, please. So there are some risk factors associated with diabetic retinopathy. How long an individual has had diabetes can put you more at risk the longer you have the disease. Having uncontrolled blood glucose levels, blood pressure, and cholesterol levels can also increase your risk of developing diabetic retinopathy. There are certain races and ethnicities that are at a higher risk. Individuals of Black, Hispanic, American Indian, Asian American, or Pacific Islander descent have a higher risk, along with those who smoke. They will have a higher risk as well. If a woman has diabetes prior to pregnancy, it's important to get an eye exam prior to getting pregnant and in the first trimester to make sure that your vision health is being taken care of, and your eye doctor will determine if she needs to be seen more. And there's a correlation between having kidney disease and having good eye health. So if you keep your kidneys healthy, your eyes will stay healthy as well. Next slide, please. So there's a few things that can be done to prevent vision loss from diabetes. One is to get, as I mentioned before, and I can't reiterate it more, is to get your yearly dilated eye exam with an ophthalmologist or optometrist. If you have type 1, 3 to 5 years after diagnosis and yearly afterwards. If you have type 2, upon diagnosis or soon afterwards. And then having yearly eye exams or more often as recommended by your eye care professional. Secondly, stay on top of your preventative care. Preventative care is working with your care team, such as your primary care provider, your endocrinologist, diabetes educators, nutritionists, dietitians, and others who work together to stay on top of your health and keep your blood glucose, your cholesterol levels, and your blood pressure levels at a good rate. Thirdly, exercise. Staying active helps your eye health as well. Help your patients find ways to make movement fun by dancing, by bike riding, playing outside, doing things that they enjoy, and make sure that they talk to their primary care provider before starting something new. Number 4 is to having a healthy diet. Explore healthy meal options, finding things that are low in fat and sugar, eating fresh vegetables, fruit, lean proteins, and whole grains, and avoiding processed foods, juices, and sodas. And lastly, number 5 is avoiding smoking. If your patient smokes, help them find resources to help them quit. And if they don't, encourage them to not start. Next slide, please. Now I want to take a few minutes to talk about some resources we have at Prevent Blindness that may be of use to your patients. We just launched this week, and we're really excited about our new Prevent Blindness Eye Health audio library. This is a library for patients and caregivers, and it offers voice-based information about diabetes-related eye health information in both English and in Spanish. This resource is free. It provides confidential information. It's available 24/7, and you can call the number on the screen, 1-833-998-5850, and you'll get a menu of options to learn about different areas of diabetes-related eye disease. It'll provide explanations on what it is, how to protect your eyesight, getting ready for eye exams, eye health during pregnancy, tips for the newly diagnosed, and much, much more. All this information has been vetted by medical experts and carefully reviewed to provide reliable, high-quality information. In addition, when individuals are listening to this audio library, there are prompts to have information texted, so they can have the information texted to them so that they can use it as a resource later as well. So I encourage you all to please check out this great resource and share it with your patients. Next slide, please. Another great resource we have at Prevent Blindness is called the Diabetes in the Eyes Educational Toolkit. It's available in English and Spanish, and it includes a wealth of different information that can be used with patients. We have downloadable and printable fact sheets. We have fact sheets on symptoms, signs and symptoms. We have information around diagnosis, treatment, mental wellness, diabetes in youth, young diabetes in young adults, and much, much more. We also have a scripted presentation that can be used with patients where we have slides and a script where all you have to do is download it and use it and educate your patients. We have a library of videos that connects to our YouTube channel where we have videos for the newly diagnosed, patient testimonials, and much, much more. And then we also have infographics that can be used on social media to educate your patient populations. And we also, one new item that we also launched yesterday is we have a podcast that Prevent Blindness does. And our latest episode for November is around diabetes and eye health. And the web link is available on the slide to learn much more. Next slide, please. And before I end, I want to share a few more resources. One is if you do encounter patients who are living with diabetes and have lost vision, we do have resources available for them as well. We have a website called Living Well with Low Vision, and it has sections for patients, caregivers, and healthcare providers. So there's information for you and your patients and their loved ones who are helping them on that website. And then we have another program called the Aspect Patient Engagement Program. And this is one of Prevent Blindness's signature programs. And it aims to equip individuals who are living with vision impairment and blindness, as well as their allies, with skills and knowledge on how to become advocates for vision and eye health at the individual, state, local, and federal and legislative levels. This program is free and it's available in the fall every year. It's a 10-week program, and you can learn more on the web link there and you can apply to become part of this free program. It could be yourselves or your patients that may be living with diabetes. And lastly, we have our Prevent Blindness website, which has a wealth of information outside of diabetes as well. We have a lot of eye conditions, anything you want to know about vision and eye health, we can answer those questions there. And lastly, I'd like to ask you to follow us on social media, learn more about the work that we do. November is Diabetes Related Eye Disease Awareness Month, and you can follow us on social media and learn what we're doing this month and learn more about our work. So thank you for having me.
Thank you, Nita. That was really great and really great information and resources. I always loved everything that Prevent Blindness does and all and all the great resources. And as I'm looking at this, I see that you also have TikTok. And it's really interesting because as we see as we're experiencing people come in with diabetes at an earlier age than before, really. So, that this is part of what we're kind of discussing before of being creative and trying to figure out how to reach those patients and how to create a bigger effect on them. And TikTok is one of the things that they have. They tend to use and like, and if we can start getting into that to catch their attention and give them a reliable and evidence-based information. That's a great thing. So thank you. Amazing. So we are moving on our health fair, on our virtual health fair, and we're moving on to our next presenters. And next we have Mallory Caron and Nina Sherpa Pine, and they are both with the National Kidney Foundation, and they're going to share a lot more on what they do and what they have available for you. So feel free to start, and I'm gonna pin your.
Thank you so much, Maria. Um, I'm Mallory Karen, and I am the Senior Manager of Population Health Partnerships at the National Kidney Foundation. And what my work does is really work to improve chronic kidney disease testing, diagnosis, and management in the primary care space. So, really just focusing on prevention of chronic kidney disease and increasing education around that subject. And so now I'm going to pass it on to my colleague, Nina.
Thank you, Mallory, and thank you so much, Maria and the NCFH team for having us here. We're so excited to speak with you all. Just organizing all my windows so that I can connect with you appropriately. All right. So as I said, my name is Nina Sherifa Pine. My pronouns are she, her, hers, and I'm the Director of Community Impact and Health Partnerships at the National Kidney Foundation. Whereas my colleague Mallory sits on our HQ national team, I work with a local office that's focused on California, Nevada, Oregon, and Washington. So mostly on the West Coast. And so I do a lot of similar work to Mallory, just more on that localized level, looking at population health, how we can prevent chronic kidney disease, and looking at the social drivers of health as well. So thank you all for joining us, and we'll get started. Maria, if you wouldn't mind going to the next slide. Perfect, thank you. So we'll just start off by reviewing what our kidneys actually do. And the short answer is that they do a lot. Most folks have two kidneys, and they're each roughly the size of an adult fist, and they're located on either side of the spine, just below the rib cage. So if you ever wanted to demonstrate that to a client, you could just take your fists and then just locate that the kidneys are in the back under the rib cage, either side of the spine. And one way that we can describe our kidneys is that they really function as the body's filters because they help remove waste, excess fluid from the body, they filter our blood, they keep the compounds that we need, remove the ones that we don't. But they also do many other tasks as well, to help our overall health, which includes making red blood cells, balancing important vitamins and minerals, helping maintain our blood pressure, and keeping our bones healthy, which surprised me when I first learned it as well. And as Maria and Nita also pointed out, right, our kidneys are so connected to other functions of the body, which Mallory will get into in a little bit. So also recognizing that they do these functions, but they're also so implicated in how all of our other organs function. All right, next slide, please, Maria. Oh, next slide, please. Thank you. Sorry. So what is chronic kidney disease in itself, or CKD? So this occurs when our kidneys are damaged for 3 months or longer. And there are multiple stages of CKD. We go from early to end stage. And about 35.5 million adults in the US have CKD, but 90% are undiagnosed. So we see a huge discrepancy between the prevalence of the disease and the amount of people that are actually receiving a diagnosis. CKD can lead to a buildup of waste and extra fluids in the body. It can also contribute to high blood pressure. It can increase our risk for heart disease. And a really tricky aspect of it is that early CKD, for the most part, doesn't have any noticeable symptoms or is asymptomatic. And that's why testing is so important. It's really the only way for us to know how our kidneys are doing or how they're functioning. So kidney function is usually assessed with two key tests. The first is our EGFR, or a blood test, and that measures how well the kidneys are filtering our blood. The second test is the UACR, or a urine test, and that detects protein in the urine, which can indicate kidney damage. And apologies here, the slide should actually say UACR instead of albumin. Albumin is the protein that we're checking for, but the test is technically called the UACR. And one thing we do want to emphasize is that it's really important for people to receive both the blood and the urine test, because both are needed to really paint an accurate picture of how our kidneys are doing. Oftentimes we see that people, even those who are at higher risk of CKD, are only getting one of the tests, and that's typically the blood test. So if you are checking in with clients about their kidney function, if they're going to get tested or they have been tested, make sure to remind them that they need the two tests. And early detection is so crucial because we actually now have new treatments that can slow or even prevent CKD from progressing. And so that's why we need folks to get both of these tests done so that they can be identified and diagnosed and so that they can receive treatment. And of course, another really critical way to prevent CKD or complications with our kidneys is to prevent or manage chronic conditions like diabetes. And I will pass it on to Mallory to go over that.
All right, thank you, Nina. Maria, if you want to go to the next slide. Thanks, Nina, for going over that helpful overview of the kidneys, how they function, and the basics of chronic kidney disease. So now I'd like to briefly discuss how CKD is related to other chronic conditions. As Maria already highlighted, diabetes and cardiovascular disease are very interconnected with chronic kidney disease. So the two leading causes of chronic kidney disease are diabetes and high blood pressure, also known as hypertension. Hypertension and diabetes are often conditions of obesity, and obesity can also lead to having high blood sugar, which can damage the kidneys and their ability to filter waste and fluids. So over time, this can lead to chronic kidney disease and then eventually even kidney failure. So I want to highlight the fact that 1 in 3 adults that have diabetes also have chronic kidney disease. This is important to point out because we want to emphasize that CKD is not an isolated condition. If you have diabetes or are at risk for diabetes, you might also be at risk for CKD as well. So this interconnected dynamic that we're explaining is part of a concept called cardiovascular kidney metabolic syndrome, or CKM. And CKM is defined by a group of related conditions that include heart disease or cardiovascular disease, kidney disease, diabetes, and obesity. So hopefully this diagram to the left here helps to illustrate this concept and how these conditions overlap and affect one another. We can't look at diabetes or even chronic kidney disease in isolation because they're connected. And the good news about these conditions being so connected is that prevention and management goes hand in hand for these conditions. So Maria, if you could go to the next slide, please. So chronic kidney disease is preventable. One of the best ways to prevent CKD is by connecting with your healthcare providers regularly. So having several appointments a year with your doctors can really help with monitoring your overall health status. It can be an opportunity to voice concerns and to ask important questions regarding your health. Speaking with your provider frequently also really improves that open communication and trust over time. In addition to connecting with your providers, some other things that you can do to prevent or slow the progression of CKD is monitoring your blood glucose levels and recording them. monitoring and managing your blood pressure, and adopting some other healthy lifestyle habits, such as limiting salt and alcohol intake, stopping or reducing smoking, and staying physically active as much as possible. All of these habits are good to develop to effectively prevent and manage diabetes and or chronic kidney disease. Something else worth highlighting here is to help prevent your kidneys from further damage is to minimize the use of NSAIDs or NSAIDs. Individuals with chronic kidney disease should not be taking these medications. And so, what are NSAIDs? These are a class of medication often used for pain and inflammation. Some examples are aspirin, ibuprofen, Advil, Aleve, amongst some other brand names. So we understand that these medications might be necessary for some individuals. So we just really want to emphasize practicing mindfulness when taking them. Everyone's health is different, and this information is for educational purposes and is not a substitute for medical advice. So please do consult your healthcare provider for individual guidance when it comes to your health and these medications. I'm now going to pass it back to Nina.
Thanks, Mallory. Maria, if we could go to the next slide, please. Thank you. And we'll just leave you with these key takeaways from our quick training today. Screening is essential, particularly for our patients who are at high risk for chronic kidney disease. And because we know that diabetes is one of the leading risk factors, closely followed by hypertension or high blood pressure, it's important that we encourage our clients living with diabetes to connect with their healthcare providers about their kidney health. And to, if they are going to receive guideline concordant testing, remember that has to include the 2 tests of blood and urine. As Mallory mentioned, we want to support lifestyle changes. Neetha also had some great options available in her presentation. Wanted to just reiterate, staying active with a method that you enjoy goes a long way. I know for myself as well, if I'm not enjoying that exercise, I'm less motivated to do it. And that also includes helping our clients reduce sodium, limiting alcohol, again, staying active, and then as well for our agricultural workers, just focusing on reducing the use of NSAIDs if possible. I know that when we have folks that by the nature of the work that they're doing, it involves hard physical labor, they may have muscle pain, but again, wanting to reduce it the best that we can. And then our last takeaway is really just act early. Early detection and treatment can slow CKD, and that's why it's so important to review it within the context of chronic disease and to also link all of our chronic diseases together as they are so interrelated. And then just thank you all for the important work that you do. You can go to the next slide, Maria. Thank you. We appreciate you and everything that you do for your communities. Our contact information is on this slide, and you'll also get a copy of the slides later. So please feel free to reach out with us if you have any questions or if there's any resources we can connect you to. We also have a list of resources that we've compiled, including the references for this slide that will be sent out in the follow-up email by the wonderful NCFH team. Thank you so much.
Thank you so much for that presentation. And my apologies if I moved a little bit things up and down. I don't know how much you saw of that, but we are excited that to learn from all that different things that you have and how it's really interesting how a key takeaway is that we all the suggestions go to early detection, to control, to management early, doing as much as possible before things get complicated for the patient. And that's one of the things that we can always point out to, regardless of the complication we're talking about, right? But thank you so much for that. And I will send that information out of all the great resources that you guys have shared as well. So thank you. And moving along our health fair experience, and now we're going to visit the booth of American Heart Association. And we have our great Cassandra Hunt with us, and we really appreciate her being with us today. And that way she can share a little bit more on the specific condition of heart disease. And I'll pass it on to her.
Thank you, Maria. I appreciate it so much. I feel like both of these presentations just perfectly teed up the conversation, the topic that I'll be talking about today. I realized I didn't include an introductory slide, so I'm going to drop my contact information into the chat for everybody if you did want to reach out afterwards. My name is Cassandra Hunt, or Cassie. I am the Senior Community Impact Director at the American Heart Association. I'm located in San Antonio, Texas, but I cover our Southwest region, which is 6 states, including Wyoming, Colorado, New Mexico, Texas, Oklahoma, and Arkansas. So if you're in one of those 6 states and you don't already know who your community impact or who your local American Heart Association person is, please don't hesitate to reach out so that I can put you in contact. And even if you're located somewhere else in the United States, please don't hesitate to reach out. We all work really closely together, and we can help you identify who that person is, who's your local American Heart Association contact. So I'm a nurse by background, and so I really, this topic of the cardiovascular kidney metabolic health, so thank you to both of the other presenters for teeing this up so perfectly, or all 3 of the prior presenters, I should say. We're going to talk about CKMH. So in 2023, there was a presidential advisory from the American Heart Association that was released, and it was just about this time. It was the beginning of October 2023, so just right at 2 years ago. You may be familiar with this advisory, or maybe you haven't really seen much about it. So I'm really looking forward to, as a registered nurse, as someone who worked in the stroke field in the acute setting. This is something that's really near and dear to my heart, and working now on the prevention side of things, as kind of is our theme today, is really important to me, and I'm really grateful for everyone being here and talking about this. So Maria, we can go to the next slide, please. So what is CKMH or CKM syndrome? I am going to go through the sort of formal definition, but don't worry, we'll do an abbreviated definition on the next slide. So CKM is a systemic disorder characterized by the pathophysiologic interactions among metabolic risk factors, chronic kidney disease, and the cardiovascular system, leading to multi-organ dysfunction. So all of these things that we've been talking about: prevention, cardiovascular disease, chronic kidney disease, even the prevention of any kind of vision damage. All of these things play into, are all interconnected, and they all play into this prevention of all of these risk factors and all of these things in our overall health. So CKM syndrome includes both individuals at risk for cardiovascular disease due to the presence of metabolic risk factors and or chronic kidney disease, and individuals with existing CVD that's potentially related to or complicates metabolic risk factors and or chronic kidney disease. So the increased likelihood of CKM syndrome and its adverse outcomes is further influenced by unfavorable conditions for lifestyle and self-care, resulting from policies, economics, and the environment, which of course is something that we talk about when we talk about our non-medical drivers of health, and how all of those factors play into someone's overall well-being and their access to care, and they're just awareness of these risk factors and those prevention methods. Next slide, please. So as promised, here is a shorter, more abbreviated definition, simplified for all of us. It's a health disorder due to connections among heart disease, kidney disease, diabetes, and obesity, leading to poor health outcomes. And so, again, this is something that I saw so much of as a nurse, working on both the acute inpatient and the outpatient side in the vascular disease setting. We saw the interconnection of these diseases so much. And so now that I get to work in the space and work more on the prevention side of things at American Heart Association and working on the clinic to community linkages. This is something that is really, really important that we see a lot of. Next slide, please. So again, this advisory was released right at the end of 2023. So it's been about 2 years now. And then in 2024, American Heart Association launched the CKM initiative to advanced integrated whole person care for cardiovascular, kidney, and metabolic conditions, because we recognize the interconnectedness of all of these things. It's estimated that 3 out of 4 US adults have reversible CKM syndrome. So I think that's something that's really important when we look at this, to recognize that we can reverse some of these things. We can, that we can focus on getting from stage 2 or stage 1, and we can work on reversal of these things. So again, just like everyone's talked about today, it all starts with prevention. You may have heard of Life Simple 7, which is now Life's Essential 8. It incorporates sleep. So I'm happy to drop the link specifically to the Life's Essential 8 website, but it's really great. Lots and lots of patient-facing materials that you can utilize in your healthcare settings to simplify each of these prevention measures. And what numbers do you need to know when it comes to your blood glucose levels, your high just blood pressure in general, hopefully before hypertension, right? So all of these different things, what are we looking for? What are we focusing on? What numbers do we need to know for prevention, and understanding what those numbers mean, and we can really break it down. So I'm not going to dive a ton into this, the entire continuum, but I do think it's a really great visual to see exactly what the stages are of CKM and how we can focus on prevention primarily, and then reversal where we're able to, as we focus on treatment. And again, just focusing on those lifestyle modifications. Next slide. I will also say, as Maria mentioned, we'll send out the slides after the presentation and the link. This is actually an abbreviated presentation for today's purposes. And so the link that will be sent out will include the full slide deck, and that will include a breakdown of each of these stages and really more detail of what's involved. But for today's purposes, I didn't want to include every single one of those. So you'll have access to that. It is also publicly available. So please feel free to dive into that if you at your leisure. So there's a little bit of the rationale for the CKM syndrome staging. It reflects the pathophysiology of the underlying CKM progression. Again, it focuses on the importance of early detection and under-recognized clinical conditions. Each stage represents a higher level of absolute risk, and that also represents an opportunity for preventative intervention, which I think is what's really important. We talked today about the interconnectedness about all of these syndromes, and oftentimes, or sometimes, depending on each individual, they may have several specialists that they're seeing. And so what we really want to do is focus on that continuum of care, continuity of care, and making sure that each individual is getting the needs met, and that we're focusing on all the person's whole well-being, and making sure that all of those specialties and all of those processes are being addressed. And sometimes things can get missed with several different specialties and overlapping things. So we want to make sure that we're focusing on everything. So obviously there's a principal focus on cardiovascular disease, but that interconnectedness of all of them. There's an additional focus on kidney failure. And goal is to prevent, again, the goal is to prevent the progression to the next stage. Next slide. As I mentioned, Life's Essential 8 has some really, really great resources. If you aren't familiar, haven't seen that that site, again, I'll drop the link when I'm done talking. I'll drop the link in the chat so that you can have access to it, or you can just, search for it. It'll pop right up. There's lots of one-pagers in multiple languages as well. They're available for your patients that you can utilize for education. we know that there's a critical need to support the achievement of ideal CVD health, cardiovascular health before it gets to CVD, ideally, particularly healthy lifestyle in these community settings. So the space that I work in particularly is that clinic to community setting. And so how do we help provide resources, help provide links and access to these little lifestyle modifications that add up to a really big thing and add up to prevention. If we can get them access to more healthy foods, produce, fresh produce, safe places to walk, things like that, where we can help them have access to the things that their doctors, that our providers are recommending for them to be able to live a healthy life. What are those things and how do I achieve them? So that's really the space that we're working in. It does involve multi-level partnerships, again, between us and outside stakeholders. This is a lot of the work that we do. And then emphasis on strategies to enhance cardiovascular health across the life course. And as somebody mentioned, seeing that diagnosis younger and younger, we're seeing that as well. And so I think that's super important to really help even our students, our young folks understand and have these concepts. Even we don't have to be so complicated with them. We can help them understand the basic concepts of, let me add a vegetable to my plate. Let me go for a 5-minute, 10-minute, 20-minute walk after dinner, something, just anything, little lifestyle changes that are planted younger so that they can get that concept and it becomes kind of ingrained in their lifestyle from a young age. Okay, let's see, next slide. Here's the overall citation for these slides. You'll have access to these slides. And it also, you can go directly to the publication, which I will drop that link in the chat right now so that you can read the full publication if you would like. And I think the next one, yeah. So yeah, that concludes my portion. And again, I'm really grateful. Thank you, Maria, for having me on, and thanks for putting this together.
Thank you, Cassie. It's really great to have all of this information here, and you're all gonna have this information as well afterwards. Look out for that email, follow-up email following this in a couple of days. And it just to close up the recorded portion of this webinar, and I think that it all everything that we have heard leads us to, one thought, that we have to be responsive to community needs. So I know that you all work very closely with your communities and are part of your community, and that you can also lead a lot of this work, and your raise your voice and awareness, both with your patients, right? Motivating your patients to go into this healthy lifestyle changes, which as educators and as healthcare providers, and we realize that it's not easy. It's not a magic pill that they're gonna be taking. It is a lot. It is work. It is a sometimes a thing of time. It takes time to see. It takes time to see the effects and the benefits from it. But when you do see it, it's worth it. And it's just being standing them next to our communities to help them realize that. And at the same time, you can also raise your voice to for organizations such as NCFH, and such as the ones that we have brought with partners that we have brought with us today, to lead, what is it that you need as well as health educators. So just raising that awareness. We want to hear your voice as well. And your feedback is really important as well. And we really appreciate everything that you do and that you do for your communities and all the partnering organizations that we also know that we are giving us a lot of really good resources that we don't have to reinvent the wheel. We already have a lot of things available for us. And our purpose for this today is to bring all those resources to you as they are there and we can use them. So thank you for everyone's work. And I think that uh, that concludes our recorded portion of it. For those of you who are listening, who are with us right now, just stay tuned. We're gonna go to our Q&A, and for those of you listening in, we thank you for joining us.